What is therapy? You may have heard or thought about the phrase, that person needs therapy, go see a shrink, you're crazy, or something along those lines. When you think of therapy, you might expect to be laying on a couch with someone asking you, how does that make you feel? While you may encounter some or all of those things, that isn't all there is to therapy. Honestly, the definition for therapy differs depending on who we ask. If we look at the American Psychological Association's definition, they say that psychotherapy is a collaborative treatment based on the relationship between an individual and a psychologist. If we look at the American Counseling Association, they say that professional counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. Then there's the National Association of Social Workers, which says, clinical social work is a specialty practice area of social work which focuses on the assessment, diagnosis, treatment, and prevention of mental illness, emotional, and other behavioral disturbances. Now hold on a second. You might be thinking, I thought this video was supposed to be about therapy, and now you're talking about counseling and psychology and social work. What gives? Well, as it turns out, we tend to interchangeably talk about psychotherapy, counseling, and social work underneath the same umbrella of therapy. If you're seeing a therapist or are thinking about seeing one, you might end up meeting with a psychologist, social worker, counselor, psychiatrist, or some other mental health professional, depending on what you need and where you're looking. For now, let's focus on therapy. Your usual process can be boiled down to three main components: an intake session, your sessions, and then your termination. Whoa, no, not that termination, we'll get to that. As a therapist and a patient myself, I can appreciate the importance of an intake session while also recognizing how this first step can be a barrier to even starting therapy. This is the part where the therapist gets to know you better. We can ask anything, ranging from personal to family history, medical to psychiatric history, you name it, we might ask. All to get to know you better. And how intimidating is that, right? Hi, we just met, and you don't really know if you can trust me yet. Tell me all about you. Seeing as trust is a two-way street, this is also a great opportunity for you to learn more about your therapist. We might not tell you everything about ourselves. I definitely don't. And since we want to stay focused on you, we tend to focus on you. But we also want to be relatable. Once we get past that first session, it's more of what you might expect. Lots of talking, asking questions, making inferences, providing suggestions, and generally being reflective, to give you, the patient, an opportunity to process whatever you're bringing. Contrary to what you might think, it's less about us talking and more about us listening. This is the part where you might just start to figure out whether or not this therapist and their approach feels right for you. A good therapist can walk you through those feelings as long as you're open to talk about them, but lacking a feeling of connection can really hinder that process, so it's important to feel like you can trust this person. You might not trust them right away, but that's all part of the process. So say you find someone who you do connect with and they help work through whatever you brought to the table. You could potentially keep seeing them until the end of time. I know some people do. You could also work towards ending that relationship with them through a process we know as termination. We're not so cruel as to gain your trust, build a relationship, and then just cut you off and throw you back into the world without us. By this point, you probably could do just fine with the tools and changes in your mental and emotional framework that you developed in therapy. But suddenly ending a relationship with your therapist can feel like experiencing a major loss. This is the part where we help you debrief and reflect on where you started from, how you got here, and how you can keep building on your gains without us. You can always come back, but we honestly hope you don't have to. Or at least I do. Some people make all the progress and choose not to end that relationship, and that's honestly up to them. However, knowing how to process the end of a relationship like this is also part of the therapeutic process. And so, you leave, and we may never see you again. Or maybe something else happens and you want to check in or address something new, and so we start it over and so on and so forth. No matter who you see, that process probably looks pretty familiar, but I can only talk from my perspective and experiences. If you've been in therapy, feel free to let me know in the comments below how similar your experience has been to what I talked about, and if there are some major differences that I may have missed. Until next time, keep being kind to yourself, and thanks for watching.